Welcome to the Healthy Kids Minute, brought to you by Nemours Alfred I. DuPont Hospital for Children.
The seriousness of the disease varies from season to season because it's related to the strain that's out there, how prevalent the strain is, and how vulnerable the population is. The common presenting symptoms are, of course, fever, headache, generalized myalgias, we call it, or muscle aches, cough, and respiratory congestion. Influenza causes a very large number of outpatient visits and a significant number of hospitalizations.
Dr. Rosemary Casey is a pediatrician at Mainline Health's Lankenau Hospital. She explains that along with the flu itself, additional infections can result.
The children who are most at risk for serious complications are those who are certainly less than 2 years of age and very definitely those who are less than 6 months of age, particularly those who are attending daycare. The most common complication is otitis media, or ear infections. But in addition to that, they can have what we call lower respiratory tract symptoms that can be very serious. They vary from pneumonia to bronchiolitis, which is wheezing in these young babies, and at times croup.
Older kids who get the flu not only feel lousy from being sick, but can also suffer academic setbacks as a result.
In the older school-age children, they can get wiped out from it and miss a significant amount of school time and then be fatigued for weeks and weeks later.
Influenza can be shortened slightly with antivirals if identified early, but to avoid it altogether requires vaccination.
The only prevention is the vaccine. There are two kinds of vaccines. One is the inactivated vaccine, which is given by injection, and the other is the live attenuated cold adapted virus, which is given as intranasal flu.
Dr. Casey urges parents to check with a pediatrician on which form of the vaccine is right for their child and to get them vaccinated early in the season, especially if it's the first time.
Children actually, under 8 who are receiving the flu vaccine for the first time, they have to, in that initial year, they have to receive 2 flu vaccines separated by a month. So it is important to get started early and then to make sure they come back for their second one. Otherwise, it's not as effective.
This has been the Healthy Kids Minute, brought to you by Nemours Alfred I. DuPont Hospital for Children.